Let's talk about the aftercare for rhinoplasty. In most of my rhinoplasty procedures, you're going to have a splint, which is a metal plastic piece that sits on top of the bridge here. You're also going to have what's called a tip dressing, which are little 2x2 gauze. You should have gotten a supply from my nurse. If you ever run out, you can either get some at the store, or if it's during the day, please don't hesitate to give us a call. We'll be happy to supply you with more. You're really only going to need that tip dressing probably for the first 1 to 3 days, occasionally more than that, but there can be some drippage from the nose. The reason you have some drippage is that the septum, the area inside the nose where I harvest a little cartilage to rebuild the structure to the tip, that septum, there's little cilia, they're little things that beat like this, and those cilia that clean your nose are going to be dysfunctional for a few days, and it can drip a little bit, even to the point of having some frank blood for the first 1 or 2 days. Do not be alarmed. That's usually very normal. If something is bleeding more than you expected, please give me a call. You're going to be changing the tip dressing for the first day, sometimes even every 15 minutes to 30 minutes, and then by the second day, probably only a couple times that day, and probably even by the third day it's off, but there's no consistency in that. Like all my other surgeries, you could have more swelling after your second day. That's normal. Around the eyes particularly can be distorting. Most of my rhinoplasty patients don't have much swelling, but you could have some distortion that usually goes down pretty quickly by your second or third day. It'll be very congested feeling in your nose. You don't want to be using any types of sprays without asking me, but a saline spray can be good. You don't want to pick your nose or touch inside your nose, but you want to spray with some saline sprays to clear the nose if it feels congested, and you can get a couple brands that are very common, are AYR and Ocean, are nasal saline sprays that you can use inside there. If you should not be using Afrin for any prolonged time unless you have my clearance. That's basically the keys with the nose inside. The outside of the nose, you want to keep that splint dry as much as you can. There are a couple things with a splint. I really am careful to put the splint on straight. Sometimes it could be a little bit off the splint. It will not affect your ultimate your result. That's just the way that the metal folds. Do not be alarmed if you see the splint slightly off to one side. I've had a few patients call me about that. That's normal. Try to keep your splint dry. That means tub baths, no showering for the first 7 days if possible. The other thing, I know some of my patients are alarmed, they call me, is, oh, my splint fell off, what am I going to do? If it falls off in the first probably 1 or 4 days, I would like to know about it. After probably the 4th or 5th day, if it falls off, it's really not a big deal. Even if it does fall off earlier, I would just like to know about it. Give me a call so that I can take care of it, maybe put it back on. After the 4th or 5th day, if it falls off, I'm not going to put it back on. Things are pretty much set where they want to be, so don't be alarmed with that. I don't use any packing. There's nothing inside your nose that I've got to remove, and that's normal. If it is a revision case where I've had to harvest ear cartilage, the ear area will be sore the night of the procedure. Most times my patients don't have much discomfort. The only time it's uncomfortable afterwards with a rhinoplasty is if you get a sinus headache or if you get some tension headache. You can go ahead and take some aspirin for that. It shouldn't affect my result. That can help decrease some of the discomfort in the area, but it's very uncommon if that occurs. Of course, some of the narcotics I've given you can help as well. If you do take aspirin, or narcotics, make sure you take it with some food in the stomach so you don't feel sick from that. But just to get back to the ear, after the procedure, if I did harvest ear cartilage, that's the only area that can be sore the night of the procedure. I do use a long-acting anesthetic, but occasionally a few of my patients report they wake up at 3 or 4 in the morning and they just feel a little soreness, not pain, but some soreness. That really goes away by the next morning. So don't be alarmed with that, but that's something that can occur if I've harvested ear to rebuild the nose, especially if it's been a revision surgery case where I've had to use your ear cartilage. Hopefully that's helpful in terms of understanding some of the basic fundamentals following a rhinoplasty in terms of your aftercare. I would suggest for you to watch this video several times during your recovery so that you can reinforce these concepts, because there's a lot of things to be covered, and it's helpful to watch this video other than just reading my postoperative instructions.